Hi, and welcome to my podcast, the Fertility, Motherhood, and Wellness Show. True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. I honestly can't thank all of you enough. I have received calls and messages from across the world with some positive comments, some critical reviews, but loads of suggestions for the podcast show. Coming to the podcast that we are going to be doing today. So in 2012, the American Fertility Society declared that egg freezing was no longer experimental. Media went absolutely abuzz with comments like, "Let's stop rushing to find husbands and start rushing to freeze our eggs." Or, "Egg freezing stops the ticking time bomb. Have a baby at your own time." And Michelle Obama actually went on to say, "Biological clock is real. Egg production is limited." All of it kind of moving towards the fact that the ovarian reserve in women is kind of limited. Then in 2017, Apple, Google, and Facebook went a step further and said they would encourage their female staff to freeze eggs and would even reimburse them for the same. So here I am with Dr. Apurva Pallam Reddy to discuss this issue of egg freezing with all its nuances. I'm thankful to Dr. Apurva for coming on our show for the second time. We did an extremely successful podcast on coronavirus and pregnancy, which was received very well by our listeners. In fact, it's my third most popular podcast. Dr. Apurva Pallam Reddy is a young, dynamic fertility expert, obstetrician, laparoscopic surgeon, and aesthetic gynecologist from Bangalore. She is extremely active on social media, and some of her posts have millions of views. Fantastic. She's absolutely all over social media. We are recording this podcast sitting almost 2,000 kilometers away from each other with the help of some fantastic technology. So, Dr. Apurva, welcome to the show.
Thank you so much, Dr. Rajeev.
Dr. Apurva, would you like to shed some light on what is egg freezing? Let's start with the basics.
Right. I think all of us know that to procreate, we need eggs from a woman and we need sperms from a man. It's as simple as it can get. But what we need to understand is that men can continue to produce sperms all their life. But whereas for women, we have only finite number of eggs. Now, I've heard that you've done a podcast over this that's called Age and Fertility, and I've heard that one myself, and I thought it was extremely relevant and hugely informative. So yes, because we do have a finite number of eggs, egg freezing is a process of recovering eggs from a woman and storing it in liquid nitrogen at almost minus 196 degrees Celsius so that they don't perish. So this is also done so that they can be kept for a long periods of time and are used when needed. So if this is what I'm talking about, egg freezing, do you think you can tell us the difference between an egg freezing and an embryo freezing?
When eggs are fertilized with the sperms, they become embryos. And these can then be stored in a very similar manner. So like how you freeze eggs and keep them, embryos are going to be
Correct.
kept as well. And embryos
Right.
are actually more stable and less susceptible to damage than eggs or oocytes, as we can call them. Dr. Apurva, who do you think are the likely candidates for egg freezing?
Now, egg freezing or oocyte freezing can be done for two reasons. One, it can be social or medical. So if it is a social freezing that you are looking at because you are concerned about your declining fertility as you're getting older, but you still are not ready to take the plunge and have a baby yet. It can also be done for medical reasons. For example, you are undergoing IVF and unfortunately your husband is unable to provide a semen sample on the day of pickup, or if the number of sperms that are provided are not sufficient in number to fertilize all the eggs that you have recovered, then we can go ahead and we can freeze the eggs instead of freezing the embryos. In other conditions, like if you are facing any medical treatment that can affect your fertility, for example, if you are receiving any tablets or injections or any chemotherapy like what we use in cancer treatment, these medications or therapy can affect the number of your eggs also and can cause a decline. So, in this condition, you can obviously store your eggs and make sure that they don't perish. Or if you're having a genetic condition for which you may need the removal of your ovaries altogether, like in mutations like BRCA mutations, which have higher probability of resulting in ovarian cancers, or in certain conditions wherein, like a fragile X mutation, where you can have a premature ovarian failure. So, in these sort of genetic conditions where you know that either having the ovary is not healthy enough, or having the ovary even for longer will result in an early loss of the eggs. In these sort of situations, you can go ahead and freeze the eggs. So it can be for a medical reason, or it can be a social reason that you just haven't found the right partner, or if you're not just ready to have the child.
Yeah, but Dr. Apurva, one problem I think you would be facing as well, I face as well. Although there are huge number of medical indications for freezing, we know that unfortunately some young women do have cancers, and we know that the ovarian reserve is decreasing. Some people do have the fragile eggs, although it's not very common, and whatever medical reasons might be there. Egg freezing definitely is a boon for such people. Unfortunately,
Sure.
unlike in the West, India suddenly, it's not that egg freezing isn't happening for medical reasons, but it's very small numbers.
Right.
Somehow we haven't woken up to it, neither patients nor doctors. Is that something you face? Do you have any idea as to, is it awareness? Why would you think this would be?
I think it has taken us a long time to kind of even accept ART or IVF in itself. We are not as open. Like, for example, we have couples who even perform IVF but still are not willing to be open about it and go ahead and, say it out loud to their families that they have undergone a procedure. They still look at it with some sort of taboo and not as a simple medical treatment which can kind of assist them. Like, someone is not going to judge you if you're going to say that I'm going to go to a hospital and get a knee surgery done. But if you're going to tell them that I'm going to a hospital to get an IVF done, then suddenly
Correct.
all the eyes, start staring at you with thousands of questions.
Correct.
So likewise, yes, I do agree that there is some amount of inhibition and some reservations that women have these days. But it's a very, very welcoming change that we are seeing. More and more young women are coming up and discussing about the possibility of fertility preservation these days. And that's definitely a welcoming change. And I'm sure in the next couple of years, we're going to see a sea of change in this. Quite a few women are reaching higher positions in their careers, and age of marriage is also getting delayed. So, yes, I think eventually this is going to really take over. So, once a patient decides to go ahead with the process, how does the whole process happen?
Well, the procedure for egg freezing would be as follows. So before one agrees to the freezing and the storage of the eggs, we will explain the entire process involved, including the risks, so we're all on the same page. And then the clinic would also offer the opportunity to discuss feelings and concerns with the specialist counselor. So we always have a counselor in the clinic who would be talking about these things. Sometimes it's not very easy to come forward and do it. Then the ovarian reserve is tested, and we will again counsel regarding the chances of a successful egg freezing based on the ovarian reserve results. The patient is then screened for infectious diseases, HIV, hepatitis B, C, or any other medical conditions that the patient might have. A written consent needs to be taken from the patient. Once all that preparatory work is done, the patient or the woman would be given about 10 days of injections on a daily basis. The reason we do this is because we want to create multiple eggs so we can retrieve multiple eggs and freeze multiple eggs at the same time. Of course, she does not need to come to the clinic on a daily basis for this. She can self-administer these injections. However, in these 10-11 days of injections, there are certain monitorings which are required in the form of ultrasound and blood tests, and the woman will have to come to the clinic for the same. Once this part is also taken care of and we see on ultrasound that multiple eggs have been created, then she is now ready for retrieval. And these eggs will now be retrieved in our IVF operation theatre, which is associated with the IVF centers itself. One doesn't have to go to a hospital. The woman will be lightly sedated but asleep, and thus she feels no discomfort. The eggs are removed through the vagina using a very small, very accurate ultrasound guide that allows the doctor to drain the fluid filled balloons which contain the egg. The procedure lasts for about, I would say, 5-7 minutes, and the woman will remain in the recovery area of our clinic for another 30 or 60 minutes, and then she's ready for discharge. Going back home, she just needs to take it easy for maybe a day or two at the most. Again, I've had patients, I'm sure you have had patients too, Dr. Apurva, who by evening
Right.
itself of the egg collection are absolutely fit and fine and ready to go to maybe a dinner or
Sure.
a social gathering in the evening. So it's
Sure.
quite an easy process, is what we are trying to tell. However, please understand, and I would like to reiterate this, just because it's an easy process, you can't come in alone for this egg collection. So sometimes a lot of patients may make this mistake. She needs to be accompanied by someone who's 18 years or older on the day of the retrieval, so that the accompanying person can drive you home after the procedure. Once this part is also taken care of, we retrieve the eggs. A cryoprotectant, that is a certain chemical, which is a freezing solution, is added to protect the eggs, and then they are frozen. The process of freezing is called vitrification. It's a new process, relatively new. It's been around now for almost 5 years or so. And this gives better results and causes lesser damage to the eggs.
I think the most common question most women have in their mind is, are there any complications? Are there any risks involved in this whole procedure? Can you enlighten on that as well, Dr. Rajeev?
Definitely very important. I think from our end as well, we need to make this very clear that all medical procedures have risks. But the balance has to be there between the risks and the benefit, so that we favor the benefits, especially for women who are electively seeking these medical interventions. No one would want to come in for a procedure where the risks are huge. The most common risks involved are complications from stimulation of the ovaries to develop many eggs, to retrieve them, and cryopreserve. So, obviously when we make a lot of eggs, some women have fullness of the lower abdomen. They sometimes feel heaviness. They might just feel nausea. Some women have a bit of a hormonal imbalance at that time. They might just feel a little irritated, but that's about it. During the procedure, there might be minor bleeding because of the needle going through the vaginal wall, but that also stops even before the patient is shifted back to the recovery bed. And maybe infection during the process of egg retrieval. Again, it is absolutely minimal because we do give an antibiotic cover during the procedure. So fortunately, these complications are very, very rare. Okay, now moving on to this next section. Dr. Apurva, would you is there an age at which a woman should consider freezing her eggs? Like, okay, I'm this age now, I should now go in.
See, the thing is, oocyte cryopreservation is not for everyone. So this technology should be reserved for the women who are likely to experience a real decline in their fertility in the near future. Most women in their 20s have several years before their fertility really starts significantly declining, unless they have any other pre-existing medical condition like endometriosis or the conditions that we have discussed before, which can result in a premature ovarian failure. So therefore, it's best that they are counseled in order to postpone egg freezing for some more years to see if they can still have spontaneous conception, or if they really need to go ahead and have an egg freezing done. Now, what is another important aspect in the history also would be at what age the woman's mother has achieved menopause.
Very
So
true.
if, let us say, if her mother has achieved an early menopause, that is, if she stopped having her periods at the age of 30 or 35, so in previous eras, I mean, people used to have pregnancies much early. So even in their early 20s only, in case if your mom has had the first baby, so then the possibility of her realizing that her fertility was declining would be very, very less. So a good check for that would be to know when she's achieved her menopause. So if your mom has achieved menopause at an early age, that is anywhere between 35 to 40, then it is likely that even your eggs are getting exhausted much earlier. So those women also should kind of consider getting the procedure done earlier. Now, women in their early to mid 30s, who are not planning to start a family in the next few years are probably the best candidates for the. So, women already in an age group where fertility is likely to be compromised, that is 40 and over, are less likely to really benefit from an egg freezing once those eggs are actually thawed. So, women less than 40 years may be considered if they have ovarian testing indicating a good ovarian function and reserve, increasing the likelihood that egg banking for them may still be of benefit.
Right. Dr. Apurva, you've already spoken about this aspect, but I think this is very important, which is why I would like you to reiterate this aspect, because we do have a lot of women who are above the age of 30, 38, 37, 38, or even 39, coming in now and
Right.
saying, I want to freeze my eggs. So just for the sake of our listeners, what happens if a woman is 37, 38 and above? Should she be freezing her eggs?
See, honestly, stopping the biological clock is really not a complete reality. I think I would say that that's a slightly it's exaggerated. See, the general expectations are that the pregnancy rates from a frozen egg will depend on the woman's age at the time she freezes her eggs, but will not be affected by the age at which she comes back to use them. Therefore, the chances of future pregnancy in any woman older than 38 years at the time of freezing is likely to be lower than that seen for a younger woman. So, to date, there are few reports of pregnancies in women over 38 from frozen eggs. This is mostly due to the lower age cutoffs in egg freezing studies and the relatively low numbers of women who have come back to really use their eggs so far. So now that we have discussed about what egg freezing is, the social freezing, medical freezing, and who are the women who require oocyte freezing, where are all these eggs stored?
So immediately after they are vitrified, and I spoke about the process of vitrification a little earlier, the eggs will be stored in one of our liquid nitrogen storage containers for safekeeping. Mechanisms are in place to promote the safe long-term storage of the eggs. Should the woman later wish to have her eggs shipped to another alternate long-term facility, so say for example, she wants to move from a particular IVF center to another IVF center, the clinic usually will assist with this. So you will be provided with all the paperwork needed to assist you in arranging for the transport of the eggs. So there are some companies who do this transportation between IVF centers.
So, just for the benefit of our listeners, vitrification is the same as freezing. It's just a fancy word that we use
Right.
for freezing. So,
Correct.
how long do you think we can store these eggs?
Honestly, this question has not yet been answered. Human egg freezing is relatively new. When I say relatively new, it's been around for quite some time. Technology has been changing. This technology, I would say, has been around for the last 7, 8, 9 years now, I would say. And
Right.
frozen eggs are already known to be remaining viable for many months and years together, and especially in cases of younger women for many, many years. So we know of celebrities, even in India, and I can name because she's been there on the social media and declared that Diana Hayden came back after 8 years to try and have a pregnancy with her frozen eggs, and she did manage to do it. So frozen embryos, on the other hand, are known to survive 5 years and longer, and human sperms have been shown to be viable for decades altogether. So eggs, embryos, and sperms have been shown to be viable for many, many years. So now, when these women store their eggs in a clinic, you need to understand the limits of storage time and keep in touch with the clinic. You can't just do the process and walk away and forget about it. The standard storage for eggs is in about 10 years. It can be exceeded in certain circumstances. You need to be in discussion with your clinic as to how long they store, how long you would like to store, and the payment methods, etc. You must also be very careful. Sometimes you change houses, you change your phone numbers, and you must let the clinic know if you change address. This is so that they are able to contact you when the storage period comes to an end. If they cannot contact you when the storage period ends, they may take your eggs out of storage and allow them to perish. So this is very, very important.
So, do you think there is any way for us to know in advance if the eggs will survive the freezing process?
No, not with any certainty. We can't take those eggs out, check them, and put them back inside again. So, studies have shown that there is a variability in the ability of eggs to tolerate the freezing procedure. They have also shown that within a single group of eggs frozen, some will survive, some will not survive. In
Sure.
those that do not survive the freezing and the later thawing, some may fertilize when exposed to sperms and others will not. So, the point I'm trying to make is there is a variability, but from whatever data we have seen and all the other IVF centers have seen, there is a good 90-95% survival of the eggs which were frozen, especially in a younger woman.
Sure.
Okay, so let's move on to a yet very important question, because I think this is something which we women ask and we need to answer or at least discuss with these women. What is the optimal number of eggs to be frozen? Is there some number like that which has been decided?
Right. So, to place things in perspective, when we do an IVF and pick up the oocytes, we are aspirating as many eggs as possible from the women. Now, this number can vary from person to person. A woman who has an AMH of 4 or 5, that's a higher AMH, can probably give us at least 10 to 15 eggs. And someone who's probably having a lower AMH of probably only 1 or 2 might give us only about 3 or 4 eggs. So it's very, very individualistic. It is not that everyone will give us exact same number of eggs. While there can never be too many eggs frozen in the pursuit of fertility preservation, an important lesson learned from our success with the frozen eggs is that it is best to be prepared to encounter a percentage of eggs obtained that are either not suitable for freezing or are unable to survive the treatment of eggs. Now, based on the current results, we recommend that women freezing eggs for fertility preservation consider cryo-freezing at least 15 to 20 eggs. So, if you are aiming at achieving a healthy pregnancy, we should be able to freeze at least 15 to 20 eggs to ensure that you have a very high probability of achieving pregnancy eventually. Especially in women at younger reproductive age, that many eggs may be available from just one stimulation cycle itself. But in other women, the option for a second or perhaps even a third cycle may be needed in order to achieve the goal.
True, I think that is very important to stress that in a young woman it is possible, but the older you are, we'll have to stimulate you maybe again and again, rather stimulate your ovaries.
Sure.
Another common misconception is that if you've taken out 15, 20 eggs from my ovaries, will I reduce my available eggs for later? So are you taking away all my eggs and I'm going to achieve menopause very suddenly?
No, not at all. So, in the beginning of your each menstrual cycle, literally hundreds of eggs are beginning the race to ovulate. As we've discussed before, each month you have certain hundred of eggs which are depleting. Only one egg of this actually achieves ovulation, and all of them degenerate and they are lost forever. The medications that we are using will allow us to get more and more eggs to ovulate, which would have otherwise been lost to maturity. So we are retrieving these eggs and we are freezing them. So technically, we are not taking away from your ovarian reserve. We are only trying to make maximum out of your existing cycle.
Perfect. Now, what happens if a woman has irregular periods? Can such women also freeze their eggs?
Of course, most women with irregular cycles have plenty of eggs and they just don't ovulate regularly. So these eggs can be stimulated by freezing just as easily as in any women with regular periods. Part of the initial evaluation for all women considering freezing includes testing in order to evaluate the hormonal status, the number of eggs, and if they are ovulating or not.
Right, correct.
Do you think there are any other risks to the mother of the future baby from this procedure?
I think perhaps the greatest known risk to fertility preservation, egg banking, is that some women will now delay pregnancy, which they otherwise, would have taken up. They would have probably thought of getting pregnant. But
Absolutely.
now, because they feel that, oh, I've done egg banking and I
Right.
don't need to get pregnant anymore, and I will come back some later time to try and get pregnant. The problem is, we can't guarantee them a pregnancy. And she's banked on this egg freezing, thinking that at 45 she'll come back and she will just get pregnant. Now,
Sure.
because there is no guarantee that the number of eggs that she has frozen with us will definitely give her a life pregnancy, and if at that time the procedure fails, she has no option left, because by that time all her eggs are gone and we can't make any more eggs for them. So I think this is one, I wouldn't say a risk to the mother, but yes, this is something which needs to be kept in mind. As far as the
Sure.
baby is concerned, it has been shown that freezing does not harm the genetics of the egg or the embryo in any way, and the baby born out of them will be just as normal as any other.
Absolutely. I think we can't stress that fact enough that babies born out of oocyte freezing are as normal as any other child themselves. The only concern for the mothers would be in case if they get pregnant at a very late age, we call them as an elderly crimey, and they might have complications in pregnancy because of the age and definitely not because of the cryopreservation.
True, true. Okay, one concern which a lot of women do voice is, you've taken out my eggs, so now you have my genetic material. What control do I have, over my eggs? What can I do with
So
them?
that's correct. So that's a reason where legalities and consent forms play. So the consent forms allows you and gives you the power to specify that you consent to your eggs being stored, then used in your treatment alone. How long you want to store these eggs, be it 5 years, 6 years, or 10 years being the maximum standard duration. What should happen to your eggs in case of any unfortunate or unforeseen event, either for you or if you are unable to take any decisions for yourself? Whether the eggs are to be used for your own treatment only, or whether they can be donated from someone else's treatment or used in for research or training purposes, all these conditions you will be able to take a call on. And if there are any other conditions you may have for the use of your eggs, even you can specify them in the consent forms that you sign before you get the procedure done. So you can vary or withdraw consent at any point, either before treatment or before the eggs are used in research or training. If this happens, your eggs will not be used.
Perfect. And what happens if when the woman wants to use her eggs? So she's decided now that she wants to use her eggs. What needs to be done now?
So, as we've said before, for any couple to get pregnant, we need an egg from the female partner side and we need a sperm from the male partner side. So, we already have the eggs which are stored. Now, you just need to obtain a fertile sperm from the husband. And the only options for pregnancy at this point are an IVF, that is in vitro fertilization, wherein we just place the sperms and eggs together in a small dish and allow the sperm to naturally fertilize the egg and result in the formation of an embryo. Or we can try and do an in vitro maturation, that is in case the eggs that we have aspirated are premature eggs, then we can allow them to mature a little bit more and then fertilize it with the sperms. Or we can directly go ahead and inject the sperm into the oocyte, which is called as ICSI, that is intracytoplasmic sperm injection. So we need to understand that once your eggs are frozen, the subsequent possibility of achieving pregnancy using these eggs is only going to be through an IVF procedure itself.
Correct.
So what is the chance of having a baby with frozen eggs? Does oocyte freezing really guarantee a baby?
As we were discussing a little earlier, the use of frozen eggs in treatment it's new. It's even if I say 7 years, it is still new. And although the American Fertility Association has declared that oocyte or egg freezing is no longer experimental, you've been using frozen eggs in your donor egg cycle. So, just for the sake of the listeners, sometimes some women don't have their own eggs and they need to borrow eggs from someone else. And what we do is we have professional donors who come in and donate eggs, for the sake of mankind and for the sake of someone else having eggs through their own eggs, through the eggs of the donor. So these eggs are now frozen. The point I'm trying to make is clinics have been using frozen eggs for donor egg cycles for quite some time. So we have a lot of experience with them. And we know that results can be sometimes, unpredictable. Sometimes it does very well, sometimes not so good. The results will greatly depend on the age of the woman at the time of freezing and the initial egg quality. I think this is something that we can't reiterate enough. The younger you come, the better it is. With all parameters being perfect, the chances of conception should be just as for any other woman who comes in for a regular IVF. So I hope the message is clear.
Absolutely.
Okay, so Dr. Apurva, one last question to you. And
Sure.
you've already mentioned that, once eggs are frozen and they need to do an IVF or an ICSI or something of that sort to get pregnant. So if a woman has had her eggs frozen, does it mean that she necessarily has to undergo an IVF to get pregnant? Or is it possible that she can still get pregnant naturally once, she has a partner?
Right. So, in order to set things a little more clear, as I mentioned earlier, in case if a woman has frozen her oocytes and if she wants to get pregnant using these frozen oocytes, only then will she definitely have to undergo an IVF. But in case if she wants to get pregnant naturally, or if she does get pregnant naturally, there is no need for us to really use these oocytes. I keep telling my clients that doing an egg preservation or an oocyte preservation is also something similar to getting a health insurance or probably a car insurance
Correct.
for your car. It's like you have to do it, but it's not really necessary that you always have to use it. So if you are fertile and if you take away the pressure and stress that, okay, I don't have time, I probably might not have sufficient eggs left in me, take away that pressure from a 35-year-old or 36-year-old woman, and probably she has a much higher chances of getting pregnant as compared to someone who's so unsure. So even someone who's having an oocyte freezing or egg preservation, it's really not mandatory that they have to use their frozen eggs. They can very well go ahead and try planning for pregnancy naturally. And if things don't work out for whatever reasons, they already have an insurance that is waiting for them in one of the ART centers.
Fantastic. So this brings us to the end of yet another podcast. Thank you so much, Dr. Apurva, for being on the show. I hope our listeners will take back a lot of information that will dispel some myths and also help them decide if egg freezing is for them. Thank you so much for being here.
Thank you so much, Dr. Rajeev, for having me here once again. It's been a pleasure.
And for all our listeners, please keep your reviews and suggestions coming. I'm getting some excellent ideas from people about improving the podcast as well as topics that I can cover in future. If you do get a chance, do go and look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic of your choice. This podcast is available on Google Podcast as well as an Apple Podcast. Do subscribe on any one of them or on Apple Podcast and leave your comments, suggestions and hopefully a 5-star rating. Look forward to great interactions. Keep listening.